Is there an optimal diet plan that actually works to lower your blood sugar levels? Unfortunately, there isn't a perfect one-size-fits-all or a universal diet that can magically lower your blood sugar values when followed by any and all individuals with diabetes. A diet that is rigid to extreme crash diets or trending fads is neither ideal nor sustainable. However, there is a way to determine and personalize a diet plan using precision nutrition through a combination of multiple approaches that have been scientifically proven to yield the best long-term health benefits, thus making the most optimal diabetes diet for you. So what is blood glucose and how does it changes levels affect your body, your health? So before getting into how CGM helps in determining an optimal diet plan, we must get first a basic understanding of blood glucose levels and how it affects your health. Blood sugar, also known as blood glucose, comes from the food you eat. Your body digests that food to create glucose, which at normal levels is a precious fuel for all cells in your body. The glucose that isn't needed right away gets stored in cells for later use. Type 2 diabetes is a condition that's characterized by high levels of blood sugar than the normal. Over time, the excessive glucose from the unmanaged diabetes starts behaving like a slow-acting poison, damaging your body and leading to problems with your heart, kidney, eyes, and blood vessels. High sugar levels also erode the ability of cells in your pancreas to make the insulin, making the organ overcompensate, resulting in high insulin levels and permanently damaging the pancreas over time. High levels of blood sugar can cause changes that leads to atherosclerosis and hardening of blood vessels. How are blood glucose levels measured and what bearing does it have on selecting an optimal diet? So studies have shown that normal blood glucose levels among healthy adults are typically under 100 mg per dl, and variations in values are measured through the test for fasting and postprandial blood glucose levels. So it's like normal, the fasting blood glucose is less than 100 mg per dl. Postprandial glucose is less than 140. For a pre-diabetic range, 100 mg per dl to 125 mg per dl is good for fasting blood glucose and 140 mg per dl to 199 mg per dl postprandial glucose. For diabetes, 126 mg dl or higher is the fasting blood glucose and postprandial is 200 mg per dl or higher. What are some ways to identify which food affects causing fluctuation in your blood sugar levels? So first is glycemic index, a numeric score assigned to a particular food based on how drastically it makes your blood sugar rise after consuming 50 grams of the same. So a food with higher glycemic index rises the glucose level more, and the lower a food's glycemic index is, the slower the blood sugar rises after eating the food. However, glycemic index has drawbacks that make it ineffective to formulate an optimal diet plan. Not personalized enough and cannot predict how your body might respond to the carb content in a particular meal. Does not take into account other key factors like genetics, sleep quality, stress levels, weight, your gut microbiome, food combos, and insulin sensitivity. It does not take into account the potential health risk from conditions such as heart diseases, obesity. The same food may impact another person very differently. Each of us absorbs and utilizes food in distinctive manner, leading to better health or to dysfunctioning. The second way is through continuous glucose monitoring, that is CGM. So it's a device that automatically tracks your blood glucose levels day and night, a few days or hours, and allowing you to monitor upward and downward trends of your glucose levels. A CGM tracks your sugar levels over a few days or hours and gives you data and feedback about how the food choices you made have affected your blood glucose levels and to what extent. So what are the three key aspects tracked on the CGM that enables to optimizing your diet plan? CGM allows you to check your glucose levels and look out for the following three key changes and take appropriate and effective actions. First is post-meal spikes. Postprandial hypoglycemia can be managed with the right choice of food. Individuals with the condition are at the risk of type 2 diabetes, heart and liver diseases, obesity and cancer, among other diseases. Second, glycemic variability. Since lowering glucose levels is the key goal, you can track when and what caused the glycemic fluctuations. The ideal glycemic levels should not exceed 120 mg per dl and be less than 100 mg per dl for most of the days. Third, fasting glucose levels. Maintaining a healthy fasting glucose value of under 100 mg per dl by following an optimal diet of not consuming any calories for at least 8 hours before taking the reading. So what is the role of CGM in creating an optimal diet plan? You can effectively leverage the power of CGM to assess data and feedback that shows what and how your daily food choices affect your glucose levels in real time. CGM gives you data and feedback that's showing how daily choices affect your glucose levels in real time. This is a real boon in the world where there are a plethora of healthy food choices that tempt us at every turn and through multiple media outlets, shops and nutritionists, advertising and offering multiple diet plans. Using CGM, you can create an optimal diet plan based on the data that shows the link between the meal you eat and your blood sugar levels and the metabolic responses. Talk to your health provider today and choose the best suited CGM device and try it yourself.